or they were given a thesis by their mentor, uh, that thesis has redefined themselves in their life and also redefined ophthalmology in many ways. I can give multiple examples to this. When you are given a thesis by your guide, you don't have a choice. I don't know. I mean, we just say, okay, look into these three things. Depends on what the guide is interested in. I don't think we are in that state where we are very uh, enriched to choose a thesis which might affect us in the future. So basically, it's something which is gift to you by the destiny. And if you get a thesis which probably has a great uh, way to make your destiny, I think you should be considered yourself as a blessing. There are many times people have said, "Sir, this thesis, I don't think I can ever do it. It looks very complicated," and all. I tell them, just wait for some times. This 3 years will change the destiny for you if you take this forward. Because I also have a teaching role in two or three European country universities. Thesis is part of the PhD. They have a PhD MD program. So it is like you continue doing your thesis and continue doing your post graduation, and you get both the programs. We don't have this here, and I feel that is something we should be looking at in the future, where they continue doing both and get something which can become we can defend the thesis to become a PhD. But when I say it's a direction of life, it gives it's the first time you're getting an insight into complete research methodology. What is good medical practice? What are the, you have to take a course of it. You have to be involved in basic statistics course. You have to look at what is methodologies, what is a research question. And when you start looking into this in a very subconscious level, this strongly becomes part of your DNA. Because when you come out, that same things, it's gone into your DNA through your gene therapy, becomes a very strong part of your life. Whether you're going to be in academics or you're going to be in a private hospital, when you look at people, I know I did just a rough assessment of people in our own system. How many of them, when they're given a thesis, have made that a part of their life? See, if you look at it, more than 65% of them who got a thesis done in a particular subject decided to take it as their life's specialty and they groomed in it. Some examples like my colleague Dr. Anand Binekar got his PG thesis was on ROP. He finished his thesis. Last 20 years we worked together. He's made that his life's job to treat ROP. He did his PhD on it. He also guided few people on that subject. So imagine that one thesis could change the life. Like that, there are multiple people who have got inspired by thesis. So there are two important factors in it. The guide should look at thesis not as a completion, but to inspire them into that specialty or take up that area of work, whether it's clinical or research based. The good medical practice, this is a great time to inculcate a good medical practice into the system because you teach them not to fudge data. Having a negative thesis should be looked at as a positive sign of good research. One thing what I say is when you get a research topic, at the end of it, you say that the glaucoma drug X was not working. So everybody gets scared. I think encouraging the students, I mean, the best of teachers are in this zone. I mean, we should see that this is something which we need. Today's drugs which we use, including the obesity lowering drugs like all these new things which are coming, they're the side effects of the drug which was supposed to have worked for something else. We have multiple, there are serendipities in this situation. So what is important here is In the thesis, a successful thesis is not when you get your p value. So, successful thesis is when you don't get a p value, and that is when you have to go and start looking at it. And I'm sure journals like IGO and many other journals should be very keen to look at this. So, what my point, 3 points which I mentioned is one, the power of making this your life. So, whatever thesis you get, look at this as this could be part of your future life. Second, this is a great orientation to everything, including having a healthy medical practice of research. We call it as a research hygiene. Look at it as opportunities. Look at in what I could, and every thesis, less than 20-25% of theses get into publications because the topics they feel is not good enough to be published. Even if it gets published in the most low impact journal, try to do it because that gives you a kick. The first publication is the most important publication because that gives you the best feel, that surge, the dopamine, the serotonin surge, we can take it forward. And lastly, to the all the guides out here, encourage thesis which gives you p values which are non-significant, and I feel that is going to be the game changer in many things because everything is significant. Then we are living in a very utopian world when everything is perfect, and we can't be perfect. Thank you.
You, sir, for sharing us your real world experiences and the lovely talk. Professor Lane, sir. Professor Lane, sir.
Yes. Tell
Sir,
me.
your take on means what a newly guide candidate or the guide can do to make thesis something useful and productive for the lifetime, like the Rohit Shetty sir given the example of Dr. Anand Vinegar and his thesis on ROP.
Yes. So basically, see, whenever because once the Rohit Shetty sir says something, I think in the research and in the dissertation, that is the final word. So we are definitely teacher, senior to Rohit also. But Rohit is a, we can say, he is a really something we can say we should everybody salute to him. And what he spoke is very well about the p value and what he gave the topics. Basically, when I am concerned, so I will tell about the some few things which are required for the dissertation. First is the understanding the basic. It means you will have to understand the basic purpose of the thesis, and here you should contribution of the, you can say, the knowledge, critical analysis, like thing, or structural arguments. All these things are required in the understanding the basics when you are going for the dissertation. Another thing is choosing the right topic. So with the PG teacher, you should select the topic, and this topic when you are selecting, that topic should have the enough scope for the data and the research and everything, and that you can select it with the your PG teacher discussion with your colleague. Very important. Now the another thing is whenever you are doing the dissertation, then you should also develop the research proposal. Not only just the making the dissertation, it is always better to develop a research proposal and help that draft which you are making. The Rohit said that any journal, small journal, it should go. For that, you should have a research proposal for that. Now, another thing is when you are conducting the literature review, see, we have to teach them how to search for the relevant papers, which are the papers in that dissertation, in the topic. So relevant things should be there, and then encourage the critical analysis like that. It is not required that you should be like that, but you must be accepting the critical analysis also. That is very important. The other thing is a research methodological guidance. So here you will have to, whenever you are approaching the methodology, that may be a quantitative, qualitative, or mixed, that you will have to guide, and teachers should guide them in the research methodology guidance also. And what happens, the students are doing, but they should understand the sampling hai. If it is a sampling, data collection method is there, statistical tools, that they should understand, so that they can definitely go ahead and do it. So another thing is, the once they collect the data, no, only data collection is okay, but they should analyze the data. And here we'll have to guide them on the ethical consideration, or you can say the data collection, how they will collect like that. And then you can say the structure, whenever you are making the structure. I think normally what we were talking about the structure is, you can say the title page, abstract, or you can say the introduction, review of literature, methodology, result, discussion, conclusion, or recommendations or references or appendix. So these all things are, I think, definitely will guide the student whenever you are making the dissertation. And here you will have to write and edit. So you will have to encourage them only. You write, edit, and bring it to me, so that I can see, go through that and guide them. If you are, what happens, we always see the dissertation in the last 3 months when he is appearing. Instead of that, there should be a monthly review or 3 monthly review of the dissertation, that what he has done or what she has done, or what is the progress of the dissertation every 3 monthly. And that dissertation, when you see, then you write down the critical remarks on that dissertation, that you have not done this, or you have done this, or you have to done this, guide them. Instead of, if you want, don't give the negative remark, give positive. So here you are done in 3 months good work, this, but you require to again concentrate more on this. So I think if you guide 3 monthly or 4 monthly that dissertation, and accordingly they do, definitely some people get more involved, and that will make their life in the future. I feel like that. So I think it is a you can say both teacher and student together can definitely do a good work, and the teachers can inspire them, and student get inspired. Thank you,
Thank you,
Deepak.
sir. Thank you. We all know that the time management is key for the any success, and the same is true for the research. So I'm going to invite Professor Namrata Sharma, ma'am. She is having more than 14,000 citation for his research publication and one of the most dynamic leader of the IVS. Ma'am kindly gives us few tips how to manage the time or the time management and the milestone during the publication and the research. Ma'am, you are muted. Ma'am, kindly unmute yours.
Thank you, and I would like to thank Dr. Prashant Bhavankule and Dr. Deepak Mishra for having me here. The topic of discussion is time management and milestones, and I think that holds true for all time management that is there, not only about this. I think we need to do time management because thesis is a time-bound activity. You have to finish it in 18 months, so you have to plan that you have to finish actually in 16 months. And it is important that you do not procrastinate over it. And also, it helps you to focus better. Once you've already done a thesis, you know how to do the studies better. So you should meet the deadlines and yet maintain high quality work, and this would reduce the stress as well as the last minute rush. We do understand that when a candidate is doing thesis, he's also doing all the other things, imbibing the clinical skills, learning the surgical skills, etc. But I think thesis is something which is very important. Now, consequences of poor time management, as far as the thesis is concerned, is it will delay submission, compromise of the quality of the research would occur, and then also it will increase anxiety. The key focus areas as far as the time management is concerned is that you have to make a complete timeline of how you are going to do the thesis, and also set realistic milestones, because there may be times when you are more busy and you cannot focus too much on thesis. So I think addressing the timelines is extremely important. Then you should have what we call as SMART goals, that is specific, measurable, achievable, relevant, and time-bound goals. and they should be specific in your thesis as well. So what do you want to see in your thesis? What is measurable? What is achievable? What is relevant? And what is time bound? I think the first most important thing that you need to do about a thesis is that you have to select your topic, and then you have to do literature review, because there's no point doing something which has already been done, and novelty is what we are looking at. So you have to look at a specific question which you have to answer. So instead of saying that you have to do the whole thesis, you have to break it down into tasks like introduction, method section, analyzing the data, discussion, and conclusions. Uh, Generally, just like you do everything every day, like you get up every day, you sleep every day, you eat every day. Likewise, you have to plan this also. That is your thesis. Do some bit of work every day. So a specific time should be set aside for doing your thesis work. And I think the most important first thing that you do after your guide has given you the thesis is writing down the review of literature. That, in fact, you can do even before you've even sent your protocol, and then you can add at the conclusion of the thesis whatever has been added, and be vigilant about whatever new thing has occurred, because whatever new thing has occurred, you have to incorporate that in your thesis, and before you publish. So even the day when your thesis goes for publication, it is important that you do the review of literature and add that abstract into it. Then it is important that you communicate with your guide. Most often what happens is that the candidate comes to you only 2 months before or 1 month before, and then you are forced to sign whatever the candidate has written with minimal corrections. So it is important that you meet your thesis guide at least monthly, if not bi-weekly, and set an agenda beforehand so that the discussion remains focused. So this is generally the timeline. In the month one, you have topic finalization, literature review. It can take 1 month or 6 weeks for it. Then research proposal, finalizing the methodology, etc. Very important is that you send it for ethics approval, because ethics approval itself will take time, because in some of the places the ethics meeting may not be held every month. Following which you do data collection, then you do the methods you already know, you've written in your protocol. If there are any detailing of the methods which is already written in the protocol, you have to elaborate on that. And then you have to discuss and conclude. And then month 14, 15 would be review and revision with your guide, and then final submission. So your target should be 16 months, although you do get 18 months for it. So first milestone is you finalize the thesis topic and the research question, and that generally your guide will tell you. Then you collect the relevant publications, journals related to your topic, and you do the review of literature and put it into a table with the year, the journal in which it is published. Subsequently, develop research proposal methodology, that is timeline for data collection and analysis, and submit research proposal as fast as you can to your ethics committee. Then the next milestone is data collection and the preliminary analysis. So once you collect the data, unless it is a randomized control trial, you cannot know the results, but still you collect the data and you analyze it if it is a prospective study to check for data integrity, and then start the basic data analysis once you've collected it. Then for the next 9 to 12 months, you have to write the methods and the results. So I think the first thing after you complete your thesis, you analyze your data is writing your results, getting your tables right, because your tables will help you to analyze it better and to then do discussion and conclusion. The time frame for the discussion and conclusion is also say about 4 to 8 weeks or 4 to 6 weeks. And then you should always mention the limitation of this study and conclude with the summary of key findings and their significance in ophthalmology. And then as you submit, it is important to review, revise, and finalize your draft. And once you've done that, show it not only to your chief guide, but also to your co-guides. Most cases, most institutions would have some kind of a thesis presentation. So you practice before you present, just like a school child, he just mugs up the rhyme and then presents it. So your presentation should look extremely effortless, and a lot of effort goes into when you are presenting, because this must be your first formal presentation. So for every slide you write down 2-3 lines what I'm going to speak. You should stay on track. That is very important. And so you have to set mini deadlines once you have these major deadlines, and regular meetings is important because that will only make your thesis better. Now, there are common challenges, procrastination, because you don't want to, you sometimes become too lazy, or there's data overload. If there's data overload, then you have to put it systematically. Then there may be block in the way you write. So you seek help from your senior residents, etc. And in general, there may be lack of motivation. You are more interested in doing, surgeries or acquiring clinical skills than writing thesis. But I think the crux of the whole thing, whether you do surgeries or you acquire clinical skills, is that the results should be known in the proper perspective, and that a thesis can only give you. So to combat procrastination, you have to develop accountability by sharing deadlines with your guide. You have to use positive reinforcement tasks, like once you complete a small task, you can have a small reward for yourself. Set achievable deadlines, and you break large tasks into smaller ones. So to conclude, time management is very vital. Clear milestones have to be defined. Consistent effort is required. And it is important to be planned, because once you plan it well, then execution of the plan only takes 20%, but making a plan and working towards it would take about 80%. And sometimes your guides may be critical, but don't get discouraged by it. They are only trying to make you better. And at the end of the day, you are going to bless them only for this. I put this thesis here because this was by Dr. Priyadarshini, my guide, and this was first thesis which came and which was published without any even minor revisions. So we sent it to American Journal of Ophthalmology, and it got published immediately. And once you see this book, which is there on your name, it is truly, truly a moment of joy. And this was the publication in the American Journal of Ophthalmology. So all the best to you for future, and I'm sure you all are much smarter than us, at least the next generation, who has all the tools on their hand tips, on their fingertips, whether it is iPad, or whether it is putting the references down, or we used to type everything, and I think now softwares have made it so easy for you. So all you need to do is apply your brain in the right direction and to get the best out of your thesis. And I think thesis is something which is one of the first publications which almost all of us have, and it is like your first love, and you cherish it for all your life. So all the best, and thank you so much for your kind attention.
Thank you, ma'am, for such a mesmerizing talk. Dr. Mita Joshi, ma'am, one quick comment from you, then we will move to the next speaker.
Yeah. Thank you, Dr. Deepak, and thank you for this opportunity. It has been wonderful listening to ma'am, and what she has said is very true, because what we usually do is we go in for all the work last 2 or 3 months before the exam, and then it is a rush to write down the thesis. And the way she has divided the things into smaller tasks, so that it is easier to complete the whole thing. Because what happens is, when you write down something, and even if you read it after 2 or 3 months, you feel that what rubbish you have written. That is how this things work. So you need to revise it again and again, and putting it into smaller achievable targets is one of the best way of doing a thesis.
Thank you, ma'am. For any work, when we are going to do it, we face some challenges. And same is in the field of the publication. So I'm going to invite Professor Amandeep Singh, sir, who guide us how to overcome these challenges while writing thesis and other things. Professor Amandeep Singh, sir.
Are my slides visible?
Yes, sir. Your slide is visual and audible too.
Yeah. Thank you, Dr. Deepak. Thanks for having me. Special thanks to Dr. Lane for this amazing initiative. So at the outset, I think my job has been really made easy by Dr. Rohit and Dr. Namrata, but still I will try to elaborate that how to navigate this path of 2.5 years somehow, and what are the practical tips and examples. So this was the practical tip as example, and I'm covering overcoming challenging and the common obstacles. So this is how the origin of thesis is. You join after a college, after your exam, and then thesis topic writes and you present it to your guru. And uh, so I thought, why not? Let's hear it from the horse's mouth. The student itself, that what challenges do they face? So I designed this Google form. Nowadays, it's a tech-savvy world. We get answers, and these answers are, again, nobody knows who has given which answer, so we don't mind it. But it gives us a real perspective of what is happening there. So I gave them actually 6 questions plus one paragraph. These are my present. These are our department's present postgraduates, and few of them who have already, appeared and went on for in their future lives. So I've also given them the other there. So I wanted them to write if I'm missing a few of these, obstacles there. So as you can see, my questions were something like, I asked them, what is the most common obstacle you face while recruiting your patient for a thesis in a prospective study? So this is the answer which I got the most was, they are not posted in the related clinics for enough time. And this is, you all must have seen it, that this problem is there, that they face this challenge that they've given a topic concerning to say glaucoma, and they are not posted in that glaucoma for more than 3 months or 6 months, but they are not posted there. So this is the most common, one of the most common challenges saw. And then they had, again, the not posted in the related clinics at all. They've never been posted there. But nowadays, the mostly curriculums are there. They're given posted in all the areas there. And of course, they have like inability to meet the patients personally, because ophthalmology is a huge branch. So that's what they feel. One of the thing was wrong goal setting, or like this candidate have, they decided to take less than 400 microns thickness corneas and work thesis on that, and they are not able to find that those kind of patients. So this is the most common obstacles they face in case of a prospective study. And once they are into a So once I asked them, what is the most common obstacle they face while recruiting your retrospective study? Again, a retrospective study, you have to remember that the missing data or even the missing files is the most, the common obstacle they face, because they have taken a topic that I will look at the incidence of pseudophakic RD, or what happens to these patients from a retrospective data, but there are no files, there is no data. That they have to realize that yes, there will be missing data, but they should know that the files will be missing and data will be missing. So whenever they are making these excels, they have to make sure that what is exactly there and how are they are going to retrieve those files. And again, missing data files are there. That's what is there. And then again, the wrong goal setting in retrospective also the same. Like they are looking for patients vitreous changes in a pseudophakic eye, but in a retrospective study somebody may not have written about the vitreous changes all the time. So this is actually this is important while you are like Dr. Namrata said, when you're planning the studies. So these obstacles can be overcome if you have planned the study well. Like the 80% is the planning, the 20% is the execution. These are the problems actually they face. And what are the problems they face while they're writing the thesis? you know so I thought they will write about the lack of time, but the lack of time was not the issue there. The main issue was there, like Dr. Namrata said, the tables, the stats work. So they are totally dependent on the statisticians on compiling results, and they have no knowledge about the MS Excel. This is what we have to actually, as residents, as PGs, we have to learn the skill of doing a statistic. And there are n number of programs, n number of webinars, n number of the professional helps available where they can learn it. Because first of all, while you're writing a thesis protocol, you have to meet your statistician and then decide what what test you will run, what data is required, what kind of Excel you will make. And then later on, when it comes to making tables, they because they don't know about how to do it, and they're dependent on them. And this is what you can see that the major hassle is from there. And the one of them written not motivated enough. That also is a problem there. So I did ask whether there is any financial issue during the thesis work. If yes, what? So I mean, there was no financial issues because nowadays, yes, I thought that the patient may not turn up in a prospective study, but they said, I mean, there are no financial issues. They are able to motivate their patients to come. But I still feel that in a country like India, the prospective studies, there are dropouts when you have finances, because patient has to travel, and the patient has to be a very friendly, very motivated, and very nice patient, so that he can complete those follow-up whichever you want. But otherwise, they don't feel any financial issues during the thesis work. So next question was, how do they manage these challenges with recruitment, and how do they manage actually? So this is what I'm happy about. They ask their fellow JRs for help. This is fellow JRs, fellow resident. This is what I have seen, that they advertise, they write in the particular room that if you are posted in that clinic, why don't you call me? I will come and see patients. So they make every effort to overcome these challenges in a prospective study. All right. So, and again, advertise. I've seen that people I've seen in the rooms they're written there. If you have seen such and such kind of patient, please call me. And this is what they do to overcome these challenges. And this is what. And what about the 25% say the meeting authorities or the guide for help? It is very important that the administration is very PG student friendly. If you are not able to achieve your thesis goal, you can always write it to them that I want to bring down my sample size. Nobody will say no, provided they have to come to the authority. Like Professor Lane said and Professor Namrata said, you have to have audit kind of a thing. This is what I personally do. I try to meet my thesis student every last Saturday of every month. And this is what my audited. I talk to them that what problems they are facing. But again, meeting the authorities or your guide is of great help, because every challenge can be overcome, sample size can be reduced, a number of patients can be can be managed if you talk to the guide for help in time. So how do you manage these challenges while writing? And this is what the 46% of them they are trying to learn MS and Excel. No doubt they're very tech savvy and they're fast learners than us, but this is what they want to learn, and this is a very nice thing. And they 33% of taking help of AI. This is what Dr. Namrata said, that AI is there. This is a tool apart from the tools like Grammarly and plagiarism check. These tools can be also used to make a thesis, and it's they're very useful tools. They do take professional help and in these patients, and of course they want to start in time with the statisticians. So this is where the timeline comes, that if you are given a 2.5 years, so you finish your data collection say about 6 months before this, so that a statistician can work on it, and you start getting your or you can work on it and start writing your results, and then you have to write this thing. One of the PG said, I have been reviewing previous studies and analyzing various patterns along with exploring related research and to gain. And this is very important. Every article which you put as your reference, you should have personally read it. If you have read it, only then you put it as a reference, because you will learn a lot from that reference. And students should make it a habit that read each and every reference from first line to last line, if they want to know. If they can read those 30 articles, it will make a great thesis actually for them. Then seventh point was any other suggestion on thesis work during residency program. And they said we are very dependent on the system. System here is, if you're taking a prospective study or you're working on a pentacam, you're working on an OCT, they're dependent on the technicians who will go away at 4:30 at the work is over, but students get finished late. So this is where the students have to make a friendly relationship with them. The technician or the optometrist should be your best friend, and you should know how to get your work done. And out of the how should a thesis patient should move fast, so that the thesis patient should not take time. So dependence on the system is there, but system navigation is very important that you can learn. They want thesis and protocols and writing workshop. Yes, they are not being done, but they should be made the regular affairs in all the colleges who are taking these PG thesis. And EMR is a great tool. Recently, for last 5 years, we are working on EMR, so they're really enjoying it because the data collection and the things are very good in that. Topic close to their heart. It's a good news for PGI that our present director has found the old rules that they can choose their PG. Like everybody doesn't have to be lucky like Anand Vinekar, but right now all our residents are very lucky. They get 6 to 9 months to choose their topic and choose whomsoever whomsoever the mentor they want to work with. And this is happening right now in PGI. And again, they want that they should be given special time when they're writing thesis in their in their fifth sem, 2.5 years, because that is important for them. I mean, this is a joke. What they say that my thesis is written blood, sweat, tears, and coffee. It should be rather a passionate. It's the most passionate work. It's the most passionate topic to your heart. You should choose, because as Dr. Namrata said, this is going to be your first novel of your life, and which you're going to cherish the whole life there actually. So thank you so much for your patient hearing. Thank you so much for having me.
Thank you, sir, for simplifying each and every problem. And what I learned or have a take-home message from your talk is, at least there will be a regular meeting between the guide and the candidate, and the candidate must go and familiar with the newer gadgets and the Excel system, or the how to record their performance. Thank you. So I'm going to invite the next person. Very few of us are, even the viewers are knowing that these all 4 webinar series, the mastermind is Dr. Rajiv Raman sir. He is the one who helped us in crafting these 4 webinars in such a way that it will be highly useful for all the PGs and even for the guides. Sir need no introduction, and I think sir is the best person who can guide us how we can take advantages or publish our own research publication or publish publication tips for the residents. Rajiv Raman sir, please.
Thank you, Dr. Deepak. Thanks, AIOS, Dr. Deepak, for giving me this opportunity. Before I start the talk, I thought I'll just add one point. Definitely, thesis is important, and I learned a lot from the previous talks. But one of the things which we have it at Shankaretra, I'm sure many other institutes must be having it. Just meeting guide is one thing, but we have something called as a thesis monitoring committee, which meets every 3 months. And all the residents, they present what is their status of work. So this gives them a bit like, it's not only meeting the guide, because sometimes my experience, like my students, first 2 times, 3 times, they meet very passionately, and then they avoid me. Wherever I am, they will just try to move on the other side. But when there is a thesis monitoring committee, which is compulsory, all of them have to make a presentation. That makes, they all come on a common ground. They know that, okay, this fellow student has done a little better work. I should cope. Now I've not done more of the data entry. My recruitment is slow. There are problems. So I think that is one thing which if institution is not doing, it's a very good idea. After that, we started about 2 years back this concept, and it has really working pretty well. So what I would be sharing today would be research publications as a resident, what you should do. I was thinking, what are the endpoints of doing a research? So as a student PG, we think that thesis is the endpoint of my research. Sometimes we start feeling that it's the publication which should be the endpoint. You become a bit mature, you start looking at that you do a research, it is not published, it is not going as a thesis, but it gives you opportunity that initial data you apply for a funding, you get grants. And another thing is you do research so that you get some patents, you create something new which others can use. So today I'll be dealing with this part, how as a resident you do research and that leads to a publication. Often we think that we do research and majority of the students that use that in presenting in a conference. I'm not saying that is wrong, but personally I feel it is just dating. The marriage is only when it gets publication. It is seen in print. So it's okay, you can present in, but that's not the asset test of peer review. So presenting in a conference is a good aim, but that's not an endpoint of a research. You should understand that. So why research publication really matters? It's integral part of medical residency and academic development. And definitely it enhances critical thinking, problem solving skills. And we all today practice evidence-based medicine, and definitely it promotes evidence-based medicine. And if you have some publications in your post-graduation, definitely it increases the academic as well as career growth opportunities. So you must understand that research should not be the end. It should not end with a submission. You should take it for till the stage of publication so that it can be used for knowledge dissemination. Definitely helps in getting in all your fellowship interviews and networking, future academic roles. If you are thinking, definitely these publications does matter a lot. Before we go into that, what you should publish and how you should do that, there are common challenges as a medical residents, why they are not able to publish. And I'll try to see that what we can do to overcome these. So one common problem residents say that no time. We have a heavy clinical workload. We don't have time to really publish. And Dr. Namrata very beautifully showed that it's not only for thesis, but time management techniques are important. If you can keep some dedicated research slots in a week, probably have realistic timelines and use some time blocking methods aside so that you have few hours of research every week. Institutional support does matter. If your institution is giving you some protected time, and sometimes you have like, no, we do have a research methodology workshop, which is done for all the postgraduates, optometrists, and it should be part of the curriculum. Even Diplomat National Board, DNB, has got research methodology and these courses that definitely helps student. The second problem is I really don't know whom I should approach. Mentorship and research guidance lack. So one of the things is seek for a faculty with some previous publication experience who can guide your manuscript preparation very early in your residency. You can even collaborate with postgraduates. I remember I did my post-graduation from Government Medical College, Surat, and I was always impressed seeing one of the postgraduate who had published a lot, looking at him and thinking that I should become like that. I should get some tips from him. It's good because more than your mentors, you talk to your fellow postgraduates and your seniors. So look for some role model in them. You can use now online and institutional resources, writing workshops, and a lot of research methodology courses, and even learning statistics. You can have courses on R, you can have courses on SPSS. All of them, many of them are free. I know Coursera and many other platforms where you can do a short course that definitely helps you. And where the faculty mentorship is available, try to get engaged in any of these collaborative research proposals. And as I told you, there is also this concept which is now coming up of peer-to-peer mentoring. The student, you have, especially this is common after doing a fellowship, there are a group of students who join together and they try to do some research projects, collecting the data among each other. The other challenge is nowadays there is a the article processing charge, and that's one of the challenge which many times people get. So choose an open access journal, which even you can write a waiver. So I actually use my fellow who is posted, because if they are the primary author and they write a waiver, many times the bigger journals, they waive the charges, or at least they give some percentage reduction in the article processing charge. Many of the journals, including our Indian Journal of Ophthalmology, are very less charges, only for the publication charge is so less anybody can afford. So I think that's something you should always look into. Some institutions, they support these publication costs, and that helps these students to publish. And now we have a lot of these alternatives where even if you are not able to publish your research, you have the preprint servers, the ResearchGate, SSRN. Many of them you can submit preprints, and even people try to code these things. So it's again without any fee. Many times you can share your preprint in these platforms. Again, sometimes you will have difficulty in selecting a right journal and how to go about. So there are a lot of journal selection tools which are available now. Usually what I do is try to see that whatever research topic we have been doing, try to see where these articles have been published before. You get an idea on where you can possibly publish your research. You should follow the journal guidelines. There are reference managers which can help you. And most important thing is always keep multiple journal options. So once one journal it gets rejected, so it's not the end of the story. Many times I've seen like they just publish, they send and it gets rejected. They lose the hope. I think at the same time when you are sending to the first journal, I keep in mind where I'll send it again. I think that mentality is very important, because I'm sure many of us who have published, we know that it's not a one-time affair. You have to have that perseverance. There's always this fear of rejection, lack of motivation, and shift the mindset from that it is a requirement to opportunity, because definitely it helps. And really, believe me, if you see your name in a PubMed Index journal, it's a huge morale booster. It's like your ILM peeling, the first ILM peeling, you'll feel exactly like I've got a good journal, published in a good journal. So you should definitely, that's something which once you do, you feel that motivation, but that's something you should keep in mind. You should start with smaller publications during residency, case reports, letter to editor. And if you have an opportunity that your mentor is writing a review article, get involved in that. That's something you can initially start with. And definitely, though I told that conference presentation is not the end point, but many times these presentations become a full publication. And that also helps when you present in these meetings, networking with other researchers for a collaborative opportunity. You can definitely, as a resident, also publish original research articles. I'm not talking after your thesis, during your residency. They are high impact articles. It strengthens your CV, your fellowship opportunities. However, it is time consuming because it takes nearly 1 or 2 years to complete. And then further 6 to 12 months, you can think of acceptance. So it's not a original research article. Sometimes may not be so the key is that you get involved in an ongoing study. Many times some studies already there, you get involved in that. You can contribute in a data entry, you can do a literature search, you can start writing the initial draft. That's how I involve usually the residents as far as the original articles are concerned. Case reports and case series are easier and faster to publish. That definitely also enhances your clinical expertise and reputation. However, they are less impactful than an original article. And what you should publish as a case report is some rare disease or some association of disease, maybe a rare presentation of a common disease. Could be an outcome which is of a novel treatment, or reporting a particular type of outcome in a case management. Sometimes even the mistakes, the complications, and the lessons we have learned from that, and sometimes a very new disease entity which you find. It's definitely helpful. So you should keep in mind whenever you are in a OPD and you see any one of these, that should spark your mind. You should tell your consultant or a mentor that this is a good case to report. And now you have ample opportunities to many journals who take these case reports to publish. Systematic reviews, meta-analysis are again very good. So systematic reviews are basically summarizing all the relevant studies. And meta-analysis, it combines the data of the multiple studies and draws more stronger conclusion. So you don't require new patient data. It's very highly cited in academic literature. However, you need a little stronger statistical skills to go doing these. But again, I will say that now with these online courses, there are so many courses on meta-analysis which are free. And if you attend during probably first year when you are not very busy and do 1 or 2 courses, that definitely helps you to write these articles in future. Letter to editors and commentaries, these are the small academic pieces that provide insights, critics, and support for a published research. They also allow a critical discussion of a recent paper. It's a faster way to get published. Usually few months it comes, and often it's free to publish, and it's also indexed in PubMed. Limited word count. So it's important. And sometimes you may also use these letter to editors if you have some simple one finding which you want to tell, and you know that it cannot come as a paper. You can probably think of similar article which you find and write a letter to editor, share your small research finding there too. So as I told you before, you choose how to choose or questions you want to ask before submitting to a journal. Is it PubMed Index or Scopus or Web of Science Index journal? Is it open access or a subscription based? What's the publication fee? Does it accept short reports, letters, and case series? And one thing which, as I told you, I always see where similar topics have been published in the past, you get some idea from there. Should avoid predatory journals. They often charge very high and there is lack of rigorous peer review in them. So how to increase the residents doing the publication? So there are a couple of institutional strategies you can adopt. You can have research training programs early in the residency. You should definitely encourage participation of your postgraduates to national and international meetings. You should provide financial support to publication fee. If possible, shorter studies, you can even fund them. And most important is you should reward or recognize a research study which is done by a resident. So that's something which can motivate others also to do. As a resident level strategy, you should engage in collaborative research, team up with faculties and peers. Definitely participating in journal clubs and converting discussion into a publication is a good idea. Target index journals, low cost, try to overcome the financial barriers. And most important is resubmit rejected articles. Revise based on the comments which you have got and try to submit to another journal. So to conclude, publishing research enhances the career and contributes to medical knowledge. Start with small case reports, letter to editors, and if you have a chance, get involved in review articles. You should seek mentorship and institutional support to improve the success rates. And the most important thing is consistency. Consistency is key. One publication leads to another, and that builds the academic credibility. So residency research should not be just an academic requirement. It should be a start of a lifelong contribution to science. Thank you very much.
Thank you, sir, for such an inspirational talk, and you summarize each and every point in such a way that it means nothing can beat once if anyone can follow the golden rules set by you. Dr. Samishta ma'am, what is your take on answers talk?
Yes, sir. Thank you everyone for their great talks, sir. Like Rajiv Raman sir said, and also like Dr. Rohit said, each work has to be taken up by the resident as well as the mentor as a part of life, as a part of research, which will also help towards innovation. It is not like just because we have to do, like these days, the power of a resident needs to be filled in, which has to have at least one publication, one presentation of paper, and one poster. After the COVID days, they have allowed either or. That is, they'll have a publication or a presentation of paper or poster. we should not only stick to that, we should encourage the residents to do more so that they get. And another thing is, like he said, we should have small rewards for the resident that will encourage them. In our society, sir, I take this opportunity to thank Dr. Ajit Babu Maji, who is a mentor to us. He has initiated a Young Achievers Award in the name of Dr. Ajit Babu Maji Young Achievers Award. In that, by the person has to be within 45 years of age and has to have at least 20 publications in good index journals. And the award is given taking into consideration many other their insight into ophthalmology in the state and all. And we see that some people, maybe around some 10 to 20%, are having very good amount of publications, and they are continuing to do so. Some of them even have hundreds of PubMed publications by the age of 45, like most of you also do. So, thank you very much for all the talk.
Thank you, ma'am. Professor Lane, sir, when we thought of organizing these 4 series of the webinar, we were initially in jumbled of mind, means we are not sure how it will be possible or what are the things possible. But with the help of Rajiv Raman, sir, we planned it. And today is the last webinar of this series. Sir, your take home are golden words on these all the 4 series which we conducted on the research and methodology. One thing.
Dr. Deepak, really I appreciate you and Prashant who conducted this 4 series. And Rajiv, I think Rajiv, once Rajiv is with you and he is doing, it means it is to be good. So there is no any, you can say don't know any this one. And he is, I think, very meticulous in planning. And you both are also meticulous in planning. And so what experts spoke and all others, and they guided, like Namrata about the time management, Ramandeep and Rajiv about the research publication. I think what Rajiv said is very true. When one publication has done by some resident more, everybody will look at him, how he has published. And that is always an inspiration to others. So I think this thesis should not be a, you can say, completion. It should not be a completion, but here you should medical research so that he will learn in these 3 years that how to go ahead, how to go do the research. What happens once you pass from the medical college, then it is very difficult to reorient in the research. And what Raju said is very true, that only you are doing the research is not important. But yes, for the student, you must help them, also give them some monetary benefit, or when they are publishing, if that requires some, you can say photograph, they ask for money. So you think this support, what Raju said is very true. And once they will publish one article, I think that is definitely they will again publish throughout the life. And from that only we will get the scientists like Rohit, who started this discussion. So I think I must definitely congratulate you for the guiding the students and new budding ophthalmologists for not only dissertation, but for also the writing okay, but also for the research. And I think they will definitely get benefited from this your 4 series. And thank you very much, including me also.
Thank you, sir. From the whole team of AIOSARC, I would like to thank all the speakers, our distinguished panelists, and the whole team for giving and guiding us in the last 4 series. Means what we have done in 4 webinars, just only on the research and methodology. And a special thanks to Raju sir again for all the helps. Thank you, everyone. Good night. Thank you.
Thank you. Thank you.
Thank you very much. Thank you. Thank you.
Bye-bye. Good night.
Thank you, sir. Thank you.
Raju, thank you.